Over 1 million Malawians are living with HIV. The HIV epidemic in Malawi affects women and girls at nearly double the rate it affects men and boys. But men and boys are much less likely to know their HIV status or be on life-saving antiretroviral therapy. Men and boys often delay or avoid HIV testing and treatment due to a reluctance to visit a health clinic, fear of stigma, and a belief in masculine ideas of strength and independence. Changing the course of Malawi's HIV epidemic will require changing norms around HIV.
Mbuyo mosemu zinali zinthu zotivuta kwambiri palibe ndi shekhe yemu wina aliyense yemwe amafika mu mzikiti ndi kufotokoza zokhuzana ndi matenda a AIDS kunalibe. Izizo zimachitika munapoona kuti timaona ngati kuti si nkhani zofunikira kuti tizikamba mu mzikiti.
Nearly all of Malawians belong to a faith community, making religious leaders highly trusted and respected members of society. But until recently, discussing HIV in churches and mosques was considered taboo. Now, however, the PEPFAR Faith and Community Initiative, or FCI, has enlisted religious leaders from Malawi's 6 religious mother bodies, national organizations that represent the country's main religions, to help fight HIV and dispel myths and misconceptions. Beginning in 2019, the Health Policy Plus project partnered with the religious mother bodies, the government of Malawi, and USAID to develop accurate HIV messages targeted to men and boys. The messages are linked to religious texts from the Bible or Qu'ran that support the messages and demonstrate that protecting oneself and one's community aligns with religious teachings. The program has proven that when religious leaders speak, people listen.
Chifikira ni programu yemene ya FCI pali impact ya ikulu imene ikuchitika kumbali ya ife mashekhe. Chifukwa tikumatha pano pa kuyenda tinaphunzitsidwa tikumadusa mzikiti iliyonse kuzungulira kunoko kwa tiye mposa dera lina lililonse tikumafika ndi uthenga umenewo moti anthu akuchilandira bwino zoti azikayezesa magazi anthu ndithu akumapita kuchipatala kumakayezesa magazi ndithu anthu akumamwa ndithu mankhwala mwa ndondomeko. Ife tikuona kuti kuchipembedzo pano pa zamanyazi zinatha zosala naso kulibe pakadali pano.
Yeah, there has been a change in the access to treatment because at first the church was never involved in encouraging people to go for testing or even providing services like the self-test. But now we have people who have been trained through this project and they're able to go out and distribute self-test kit.
In parts of Malawi, some religious leaders were stopping people from taking life-saving HIV medication and instead telling congregants that prayer alone could cure HIV. The Faith and Community Initiative has worked to change that practice by helping religious leaders understand the science of HIV and that treatment does not contradict their faith.
The prayer and treatment should actually be able to go together because there is nothing sinful in actually taking medication.
Sanabwere ndiru project imene ya FCI manga nkhani zokuti ndi HIV and AIDS. Kuno ndithu anthu amayankhula za HIV and AIDS komano si kweni ndithu ndipo napo ndithu project ndithu kunoko yazwisa ndithu anthu ambiri madera ambiri ndithu kuti anthu aziwe kodi HIV ndi chani, kodi nankha munthu amene ali ndi HIV ndi ndani, kodi nankha pamaso pa Mulungu munthu amene kodi ndi ndani.
Amidst the COVID-19 pandemic, it was sometimes difficult to reach people in person. So the religious mother bodies developed radio and TV programs to reach out to people with the messages of hope. Not only did religious leaders connect in powerful ways with their communities, but they also built collaborative partnerships with local healthcare providers. These strengthened relationships between clinics and communities have led greater numbers of people to clinics to get tested and to start or resume treatment for HIV, often through direct referrals by religious leaders.
Seen more people coming for HIV testing in the areas that we've been working on, as well as also people able to believe or to understand that if they need to be on HIV medication, they now do understand that they have to be on the medication without fears of being judged at church or fears of being discriminated by those people who they associate with at religious gatherings. I think it's about men discussing freely. I think that's quite very key because the moment people are able to discuss issues openly, it means they are comfortable. That's the main thing that we would say is sort of an indicator of social behavior change. And I know that's a very fundamental step.
Over 100 religious leaders were also trained and certified to distribute HIV self-test kits to their community members. Religious leaders go to men where they congregate, at work, at football matches, or playing the popular game of bao, and teach them how to use a self-test for themselves and their family members. The self-tests have been very popular, as people can test themselves in the privacy of their own home. Over 2 years, religious leaders have distributed more than 63,000 test kits in their communities. The program has worked with national and district governments to make sure sufficient supply of these test kits are available for religious leaders to give to the people who want them. Because of the Faith and Community Initiative, people across Malawi are receiving accurate information and support from their religious leaders, which is helping them to live healthier lives.
Ndipo tava uthenga wa sogoleri wakulu wa mpingo zinandikhuza kwambiri. Polingalira kuti kulu wa mpingo mpaka na kundiuza za HIV. Kotero namutengera pambali. Ndipo tamfotokozera vuto langa anandiperekezera ku chipatala. Sogoleri anandiuza uthenga wabwino ondilimbikisa kufunika kwa mankhwala. Ndipo kotero tayamba kumwa mankhwala naona thupi langa linali la mphamvu kusiyana ndi nthawi imene ndimakhala osamwa mankhwala.
Religious leaders continue to use the messages of hope to encourage their communities to seek the care they need, to support each other, and collaborate across religions. Through discussion, song, and dance, such as this traditional Islamic zikiri dance, they bring the once taboo topic of HIV into the light. These activities make it possible for people to speak openly, receive accurate information, and keep their families and communities healthy.